we set out to try and create a forum where we could exchange information about research in these countries, in these settings. First of all, to try and identify what the key research issues need to be, so what the users want to know about. Then to bring together existing bodies of knowledge and to have an exchange to share that across the membership, but also to try and promote future research. We have over 300 people in the group. At the moment with LinkedIn, it's not possible to get a simple breakdown of where people are from, but we have we seem to have a mixture of people working on the implementation side with NGOs, some donor representatives, a lot of researchers, and quite a few students have joined through various networks and so on. If you're already a member of LinkedIn, it's very easy to find us. Just put in fragile and conflict-affected states into the search engine and you'll find us, and there's a yellow button that says join. If you click on that, somebody will let you in quite quickly, and you'll be very welcome to join. Of course, you can go to the Health Systems Global website, which has the list of all the thematic groups, and you can access through there. We've achieved the first of gathering together some of the existing research. One of the mechanisms we used for this was to have a special issue with the journal Conflict in Health. And we had an open call which we put through the LinkedIn group and various other mechanisms. And we managed to get 11 papers on that, and some of them are classed as highly accessed because it's an online journal. And we've also promoted some of them quite widely through briefs, and we had a very interesting Twitter chat at the beginning of February where we took one of the themes on human resources, and we had, for over an hour, we had I think something like 200 unique tweets based on a series of questions. So we're getting some of the information out about the research that's being done in these settings. We're currently developing a needs assessment to try and identify what the future needs will be. And we're doing that in a collaborative way through online surveys, use of experts, and we're hoping shortly to be hosting a webinar where we'll be going through some of the issues and getting more input from people. I think the major achievement in terms of face-to-face was our presence at the Cape Town Symposium. It was the first time we'd organised anything other than the virtual events. And we presented some of our work and some of the papers that were being published and started the process of needs assessment. But coincidentally, USAID was interested in having Ebola discussed at this health systems research meeting, and so the organisers put them in touch with our thematic working group, and we were able to, at very short notice, organise a panel during the meeting where we had USAID, World Bank, WHO represented, and one of our rebuild researchers from Sierra Leone made a presentation about Ebola in that country, and that got a lot of attention. We had a lot of blogs that came out of it. So in a sense, what we were able to do is promote the debate on health systems research in these settings, but also publicise the fact that there are people working in these areas and there's a network. And I think after that event, our LinkedIn group grew quite rapidly.